Hello, my name is Terry Scott, and I am a nurse practitioner and a registered nurse delegator in the state of Washington. It's come to my attention that there is a nationwide shortage on insulin pens. Therefore, delivery of insulin is often occurring to the assisted living in a vial rather than a pen. This educational video is intended to supplement your hands-on delegation training as a reminder of the steps necessary to draw up insulin from a vial. This is not meant to diagnose or treat. This is for educational purposes only. Under the Washington Administrative Code, insulin injections can be delegated to a trained nursing assistant or home care aide in the facility, but only when done safely, step by step, and done right every single time. So we're going to go through the steps. I want you to follow them completely. We're going to check the 5 rights repeatedly, and I want you to watch your client for effects of high or low blood sugar as a result of care. In this process, as with use of an insulin pen, the 5 medication rights must be verified no less than 3 times for every administration. That occurs once during setup, once before drawing up, and once right before injection. As we all know, the 5 rights include ensuring that we have the right client, we have the right medication, we have the right dose of insulin, and the right time. The route will be subcutaneous in all instances in the assisted living facility. So first, we're going to check the 5 rights of medication administration. We're going to gather our supplies onto a clean surface near your client or at your station. You're going to advise your client of what you're about to do. Wash your hands. I want you to inspect the vial and recheck the 5 rights. For the purposes of this demonstration, I simply have normal saline, but what you're going to do is look at the vial. The product inside should have the appearance that you would expect. So whether it's a clear insulin or a cloudy insulin, it should not have any particulate matter and it shouldn't be an off color. You're also going to check the expiration date, and if it was open previously, generally speaking, we don't keep insulin open for more than 28 days before we replace the vial. You're going to clean the vial with an alcohol wipe. If the insulin is a cloudy type insulin, I want you to roll it between your hands. Do not shake it. Shaking it can induce air bubbles into the product, and it makes it much harder to draw up the correct amount. You're going to take your syringe and you're going to uncap the base of it. There is oftentimes a little air gap between the black plunger and the needle hub. If that's the case, I want you to push forward to get rid of that air gap because drawing up the correct amount of insulin is difficult if that bubble remains in place. And then uncap the needle. You're going to withdraw the correct number of units for the amount of insulin that you intend to give. Now, another caveat here is that most insulin comes as U100 base. Your syringe should also be a U100 syringe. That's the most common type. If a patient or a resident has a very high dose of insulin, they may use a different concentration, and you can't mix the syringes and the insulin itself. So you're going to withdraw to the appropriate number of units that you intend to give the resident. You're in withdrawing air. And then you're going to take that syringe and you're going to place it into the vial, pushing the air inside. That displaces the negative pressure so that when you invert it and go to withdraw your insulin, you get fluid rather than air bubbles. You're going to draw up until you have the appropriate amount of insulin, and then you can take the vial off. Use caution when recapping that needle if necessary. If you don't need to recap it, don't do it. If you're by the bedside, you can probably do without that step. So now we have a syringe that has the appropriate number of units, and you've checked the 5 rights twice. Now we're going to go to give the injection. Again, we're going to inform the resident what we're about to do and double check the 5 rights again. Right drug, right dose, right route, right time, right patient. We're going to put on gloves. We're going to clean the injection site with an alcohol wipe. we're going to hold the skin in between our fingers. And then when you insert the syringe, just like with an insulin pen, you're going to insert it straight in at a 90-degree angle, unless that resident is particularly thin, in which case you might have to go at a 45-degree angle. Once it's inserted in the soft tissue, this is a subcutaneous, so you need a little fatty substance. You're going to release the skin fold and inject the product. That syringe immediately goes into the sharps container. You're going to, if there's any bleeding, you're going to stop it with gauze. You're going to remove your gloves, wash your hands, and document. Document is sometimes known as the sixth right and is essential for the team to understand what has happened. In choosing the site, you're going to choose some approved sites. It's no different than with a syringe versus an insulin pen. And those areas, generally the abdomen, the upper outer arm, the upper outer thigh, or the buttocks. Again, somewhere where there's a little bit of fatty tissue. You want to make sure that that skin is intact, that there's no rash, and there's no evidence of cellulitis or other skin issue. If that is the case, you want to make sure that the provider is aware of that and select a different site. You don't want to go too close to the belly button. You don't want to inject right before a bath or a shower because the heat can dissipate that product, and you don't massage after administering the insulin. You should all be very clear on recognizing signs and symptoms of low blood sugar or hypoglycemia, which is generally known as the level below 70 milligrams per deciliter. They may be shaky, confused, they may be sweaty and cold skin, they can have slurred speech, but the worst would be loss of consciousness. If a resident is alert but has a low sugar, you're going to follow the rule of 15 and administer 15 grams of glucose or carbohydrate, followed by resting and watching for 15 minutes, then rechecking the sugar level. If the resident is non-responsive or unconscious, that's a 911 call. You cannot give any kind of glucose or soda pop or orange juice to somebody who is not responsive to swallow that. You should also be aware of the signs of high blood sugar, which can include fatigue and weakness, headache, drowsiness, extreme thirst, or dry mouth. Very late symptoms can include nausea, very rapid breathing, or a sweet, fruity breath odor. That too can be a 911 emergency. Remember that this is a delegated task. According to the Washington Administrative Code 246-840-930, insulin injections are delegated and supervised by an RN, such as myself. You want to stay within your scope, so if you have an order, read the order, follow it specifically. You will have written instructions also in the nurse delegation binder. Every resident who has insulin as a delegated task has a nursing task sheet specific to them under their name that also illustrates a step-by-step process of how to administer insulin. Document every single time. Even if a resident refuses a process, you need to document. The shift before you and the shift after you cannot track the resident's care unless it is accurately documented. And then report issues right away to your supervisor or to your nurse delegator. Thank you very much for your time. I appreciate it. I hope that this is a helpful tool that you can use to just remind yourself how to draw insulin up from a vial, as well as reinforcement for low and high blood sugars and what to do about those. My contact information can be found in your nurse delegation binder. It's bright green and should be in an area that's accessible to you. As soon as you complete this training session, I need you to text me at the number provided and let me know that you're completed so that I can make arrangements to contact you to test you on this information for the facility's records. Thank you again. This is Terry Scott, nurse practitioner and registered nurse delegator for the state of Washington. Thank you.